supine, right? So if we're thinking any kind of anterior labral pathology, impingement, possible SI joint, we can perform Faber's test. You guys perform this in MSK1. Again, it's just that flexion, abduction, and external rotation, looking for that thigh to come parallel, and then comparing side to side, looking for any pain provocation with this one as well too. So comparing side to side with Faber, okay? So for Fadir, okay, your book describes the Fadir test. Again, it's looking for any femoral acetabular impingement, possible labral tear, okay, anything intra-articular in the hip. So your book describes it. You start in flexion, abduction, and external rotation, okay? And then you bring them into flexion, adduction, and internal rotation, looking for a reproduction of pain or discomfort in the anterior hip and the groin, okay? Some texts show that you start in this position, you go here, and then you bring them into a little bit of extension as well too, to really try to scour that hip and try to see if you can really pinch that labrum, okay? But again, you're coming here, flexion, adduction, and internal rotation, looking for any pain or reproduction in that anterior hip, okay?
Dr. Sanson,
Yes.
sorry, just to be clarify, you want us to do the flexion because here it says to end in extension.
Yeah.
But for us, do flexion.
So I want you guys, just when you're doing your Fadir, just making sure you're going flexion, adduction, and internal rotation, okay? But again, your book shows that you go flexion, adduction, internal rotation, and then you come down and end in extension. But for the purposes of your skills check, practical, going into flexion, adduction, and internal rotation, okay?
Thank you.
Go to the next. So, looking at the posterior labrum, okay? So, essentially starting in that Fadir position, okay? So, flexion, adduction, and external rotation. Then you're gonna take them out into extension, abduction, and external rotation, okay? So you're thinking about trying to get that posterior aspect of the labrum as you go into extension, abduction, and external rotation.
You're basically doing like a circular motion. So for the Fadir, could we say that it would be like more of a clockwise, and then the posterior, it's more of a counter?
Yeah.
It's just passive range of motion. You're not applying any type of like downward pressure.
No downward pressure. You're just taking them through the motion. So typically when I'll do that, I'll combine the two. So I'll go here, Fadir, I'll come out, look, posterior labrum. I might go back in and just see, because I'm hitting the anterior and the posterior portion at the same time.
So if they had symptoms with Fadir, would you even do the posterior labrum?
So it would be based off the presentation that you're thinking. So if they're complaining of like anterior hip groin pain, I'm going more Fadir pain. If it's more like a global, like, you know, clicking, and it's not a specific location, I would do the Fadir and the posterior labrum test. So it just depends on where they're complaining of their symptoms. And then you have hip scour test. So this is a test where you're actually giving compression, okay? So you're gonna be giving compression through the femur, okay? So here, I like to bring my hands on either side of the knee, just in case they have any knee pathology, okay? And so I'm giving compression down through the femur, and then what I'm doing, I'm just scouring the hip, okay? Looking for any clicking, popping, grinding, any anterior groin pain, and this is just gonna help me determine if your patient has any intra-articular pathology going on, okay? So find a new partner. I want you to practice the maximal squat test do your screen of the knee. So look at patellar mobility, look at flexion and extension with overpressure, and then try these hip intra-articular pathology tests. Okay.